Welcome to Smart Remarks, where if the bill is long, that must mean it's bad. Outrage!
The only thing we have to fear is fear itself.
So the Senate stands on the cusp of a historic health care bill, and as the Republicans continue to vent their outrage, even the Democrats are arguing amongst themselves as to whether this bill is bad, really bad, or just plain catastrophic. Almost nobody seems to like this bill, and that's because there's a lot in this bill not to like. For me, it's because the bill does not really do a whole lot to bend the cost curve. You know, there's a lot of ways we might have made healthcare more affordable to consumers, at least. A single-payer system would have eliminated layers of administrative bureaucracy, really cut costs, but of course that would have cut into insurance company profits, so we can't do that. Drug reimportation from neighboring industrialized country might have saved consumers an estimated $80 billion over 10 years, but that would cut into drug company profits, so of course we couldn't do that. And indeed, under the bill as proposed, the insurance industry and as well as the pharmaceutical industry stands to make billions of dollars. They're going to have all these new customers. What's not to like?
Hey, I got something to mail you out, man. You're just freaking out. Yeah.
Still, while healthcare costs are a travesty in this country, the fact that there are so many people uninsured or underinsured is a tragedy in this country, and that is something that the bill would do. It provides significant subsidies for poor and lower income people. It means that if you lose your job in this economy, you don't have to go begging for health insurance. And that's not only an accomplishment, it's an important moral accomplishment for a people, for a nation that considers healthcare not a privilege, but a right. And here, of course, we're not talking about our right-wing friends who continue to yammer on about socialism and want to read every page of every amendment because words are bad. Outrage! Let's be clear. This bill is not a good bill. It reflects the reality of Washington horse trading and the fact that our government is so calcified and sclerotic that it's simply incapable of passing sweeping legislation. There are too many special interests, and they are too well entrenched. But given this, the health care bill is probably about the best we can hope to achieve at this point in time. It's not the best bill, it's not a good bill, but it is a bill, a baby step on the road that this nation needs to take, but a first step nonetheless. And you gotta walk before you can run. So swallow hard, take a deep breath, pass the bill.
The bill may be the ultimate political manifesto, or it may be the most delicate of compromises. The firestorm will be the same. So why not give the haters, as the cliche goes, something to cry about?